Good evening, everybody, and a special warm welcome to the future medical students of the world. Global Education welcomes you to the Study Abroad Virtual Expo tonight. Just a little brief background about who Global Education is. Global Education are in-country representatives for over 400 universities. I'm not going to share too much about our host of this evening. She will come in and give everybody a fantastic background about who she represents tonight. But basically, if a student wants to study overseas, they can come to us at Global Education. We'll help them apply. Even if you don't really know what you want to study, you're thinking about, do I want to study medicine, or do I want to study biomedical sciences, or do I want to study something else? We will help you find what it is you want to do. So we'll help you with your applications. We'll help you find and secure accommodation. And then we'll also help you with your visa should you require a visa to study overseas. I am now going to step out and I'm going to introduce my friend and colleague, Victoria. If you have any questions through Victoria's presentation, I urge you to please leave it in the Q&A box at the bottom of your screen, and we will get to it at the end of Victoria's presentation. Thank you. Hi, Victoria, and a warm welcome.
Hi, Maxine. How are you doing?
Well, how are you?
Good, good.
Thank you so much for being here. We are very excited to learn more and to have students understand what the requirements are, what the options are, what's out there for them, because it's probably the most popular course that we have in our course load. So welcome.
Thank you. Thank you everyone for joining us, making time for this session. We know that medicine has become something that we are all now understanding why it's so important. After the pandemic, there has been a lot of interest in studying medicine, and we do understand that there are not as many opportunities to study it in our own countries, and therefore people are looking for other opportunities outside. So my name is Victoria Kimotho, and I am the Regional Director for Africa for R3 Education. R3 Education is a group of medical schools that are based in the Caribbean. So I would like to share my slides. Just give me a second. Okay. Maxim, please let me know if you can see the screen.
I can indeed.
Perfect. Okay, so R3 Education has 3 universities. Seba University, School of Medicine, which is based on Seba Island in the Caribbean, but it's a Netherlands territory. Then St. Matthew's University, which is based on Grand Cayman Island in the Caribbean. And we also have Medical Universities of Americas, which is based on Nevis and St. Kitts. Now, the beauty of having 3 universities is when you do your application, you have an opportunity to get into 3 different universities. And we're really looking forward to hosting international students, because we do have universities that have been very successful in getting students to study medicine and also prepare to go and work in the US. A little background about the US. So acceptance to a US medical school is not easy. Most schools will actually require you to finish a bachelor's degree of 4 years. And then at the end of the bachelor's degree, you then apply to med school. So if you do an application for US med school, you are not being accepted into med school directly when you're doing your undergraduate degree. So you do have to reapply. So you complete the bachelor's and you apply. Now you're in a space where only 2%, actually less than 2% of the spaces or the seats available in medical school go to international students. So you would be sharing that space with students from Asia, from Africa, from Australia, from Europe, from everywhere else in the world. And these 2% is 2% of about 1,500 spaces. So you're talking about a low number. It gets down to like 200 and something. Now, the possibility of you getting in is there, but the probability of you getting in is actually very low. So a lot of students in the US and in Canada themselves could not get into US medical schools. So the Caribbean alternative was put together by investors who sought to find other pathways for medical students, even in the US and Canada, to study medicine and get into the US physician workforce. Now, it also became a very viable pathway for international students. How does it work? So international students would study medicine anywhere else and try to get into the US to end up working in the US. So they would take the US medical licensing exams, and then they would then apply to get into what is called residency programs. Unfortunately, just by the mere fact that they studied their medicine outside the US medical learning system, they already were handicapped when they were trying to get into these specialist positions in residency. I will go further into that as we talk about residency and what it means, but just know that this is a viable pathway for international students, because you then come study in the Caribbean for 2 years, let's say, then do your clinical rotations in the US, therefore giving you the same starting point with any student who has studied in the US. So it's very difficult to gauge the quality of Caribbean medical schools. One of the main ways of knowing it's a good medical school is to look at their pass rates when the students take the US medical licensing exam, and you look at the first time pass rate. Not after students have tried and failed and come back. No, look at when they first took the test, how many or what % of the students passed. Then you also gauge a Caribbean medical school based on where the residency placements are. Where do students end up? What specializations do they end up doing after they graduate from the Caribbean medical school? So all three schools that we own are actually very strong. We have 99% pass in USMLE, first-time takers. We also have places, some that are 98% or 97%. This is higher than many Caribbean schools. And I'll give you the reasons why as we go along with the presentation. Now, we do know that the US itself has a shortage of physicians or doctors. Now, the shortage of physicians is not changing. There's a report that was produced to look at what is the shortage of physicians between 2018 and 2033 in the US. You find that there's about a shortage of greater than 100,000 medical doctors in the US, meaning there's a gap in the number of medical doctors or physicians who are available to take positions of medical doctors in the country. So the US as a country is actually looking to get international doctors to come and work in their country. And this is seen or has been even more aggravated and even more clear during COVID time. There was a shortage, and therefore the international students who were studying or doing their residencies or specializing in the US ended up helping the health system take care of the COVID pandemic situation. So it has just clarified why you, as an international student, should really look into working in the US as a medical doctor. Now, one other thing that is important, or one of the main reasons you choose a medical school, is because of its accreditation and recognitions. Now, accreditation defines what your path or your journey will be to becoming a doctor who can practice in the US. Now, the ECFMG, which is Education Commission of Foreign Medical Graduates, is a really important accreditation for any international medical school to have, especially if we are telling you that you can end up practicing in the US. So all three of our universities, Saba, St. Matthews, and MUA, have ECFMG accreditation. And this is why we can confidently tell you that, yes, come and study with us if you want to be a doctor who practices in the US. WFME is also a very important accreditation. And we do have other accreditations specific to the schools. NVAO, that is the accrediting body of the Netherlands, is the accrediting body for Saba. Saba School of Medicine is on an island called Saba, which is in the territory of Netherlands. And you would get your student's visa from the Netherlands embassy. But we're the only Caribbean medical school that has a European accreditation. And a European accreditation is actually really difficult to get. So we have maintained the standards that they require, and that's why you would want to go to Saba. Now, ACCM accreditation is for St. Matthews and also for Medical Universities of Americas. I'll call it MUA. So the two universities have that accreditation. On top of that, they have the ACFMG and WFME. And then we also have other accreditations of the National Committee for Foreign Medical and Education Accreditation. These are also very important in just making your studies even stronger. And we have made sure to maintain these accreditations because it's really important for anyone studying medicine. Now, one of the questions everybody asks me is, it sounds very complicated. How do I end up becoming a doctor practicing in the US? And this is the pathway you take. So for our Caribbean medical schools, Saba, MUA, and St. Matthews, we currently have a 4-year program. The 4-year program means you finish your Bachelor of Science wherever you are. You can be at Stellenbosch, you can be at University of Pretoria, you can be in Nairobi, you can be anywhere in the world. You could have done your undergraduate in Australia, in the UK, anywhere you do it, so long as it's a Bachelor of Science. And the Bachelor of Science that we require, ideally, would be one that has organic chem, biochemistry, and all. However, if you don't have those subjects and you have a strong Bachelor of Science and you really want to become a doctor, we do have a gateway program that will prepare you to get into the 4-year program. So I'll just go straight to a student who has a Bachelor of Science and you have grades that are really good. Of course, we prefer A students would be perfect. B and C students, we accept. And what we do is we allocate you to different universities that have different levels. So now you finish your Bachelor of Science, you graduate, and you have your official transcripts. And we look at it and we see that you fit into coming to study medicine with us. So you will be in the Caribbean for basic sciences for 2 calendar years. That's about 20 months. So for the 2 calendar years, you're on the island, you're studying your histology, physiology, all those anatomy and all that. Or at the same time, you're doing your labs, you're having patient interaction, but all this is controlled because you're doing your basic sciences. So after 2 years, calendar years, you then take your USMLE step 1. Remember, I mentioned that we perform very well for USMLE step 1. So our students take their USMLEs after they do their basic sciences. This is a pass or fail. So when you pass, you then qualify to go into the clinical medicine years. These are 2 years. You will be in a hospital in the US. Some people do get into Canada, not as many. And when you're in the hospital at the US, you're doing in total 80 weeks of clinical rotations. So for example, you can do 12 weeks of emergency medicine, 6 weeks of psychiatry, and all that. So you keep rotating. And within those rotations, you're learning, you're still our students, so you're still taking your exams, and you're also preparing for what is called USMLE Step 2. Step 2 is clinical knowledge and there's clinical skills as well. Now, USMLE Step 2 is actually what determines the specialization you'll end up in. So this one is graded. It actually has marks. So you would get like 240 out of 300 points. And that's what will qualify you to go into your residencies. Now, once you take your Step 2, you graduate from us. So now you are an MD. You can call yourself Dr. Susan or Dr. Jane or Dr. Vicky. Now you've become a doctor. However, in the US system, you are required to go into what is called a residency program. Now, you stop being a student when you graduate the MD degree. However, during all this time you're studying with us, the 4 years, we have prepared you well enough to get into a good residency program. And we get 95% of our students who get into residency at the beginning. So it's not as complicated because we guide you throughout the process. Some of the things that you need when you're doing the residencies is definitely your USMLE Step 2 results, your USMLE Step 1 results, and your recommendations from the hospitals where you did your clinical rotations. So it's very important for you to follow your career guidance so that you get into a residency position. Remember, this residency position is not about your immigration, so it's not resident. You become a resident doctor, and a resident doctor is paid working for a hospital and specializing. So this is where you can do pediatrics, internal medicine, family medicine, all these things. This is where you specialize. And then you take your USMLE Step 3, you become a fully licensed medical doctor. Now, I'll give you some facts as I go back to the front to just give you some insights of some of the things you need to keep an eye out for. So once you get accredited, you get the USMLE Step 3 and you become a doctor. If, let's say, you choose to leave the country and you don't use your license for 7 years, it is revoked and you have to take your USMLE again. So usually students do not leave. They decide, okay, let me just stay in the US and work so that I can keep my license running. But you can go for short periods of time. So some students usually ask me, can I specialize and come home and do some work? Yes, you can specialize. Let's say you become a cardiovascular surgeon. You can come home and do units, do some work there and go back, so long as you don't stay away for 7 years continuous. Now, USMLE Step 1, Step 2, and Step 3 are really important. And we recognize the importance. And therefore, when you're doing your basic sciences, the way we give you your exams are in the same format as the USMLE exam. So a USMLE exam question does not ask you which bone is on your neck. What they ask you is they give you a case study, and then you're supposed to answer questions related to that case study. And your questions will not be direct. They won't ask you where's the stomach. They might ask you, how does the digestive system work with the adrenal glands in your head? And they would want to know a patient who has thyroid deficiency. How do you tell, or what are the symptoms? So these are some of the things that would come out. Therefore, when we're teaching you in basic sciences, the way we teach you is according to the body systems. So we would not come and teach you basic sciences on this is the stomach and this is the adrenal glands. No, we would be teaching you the adrenal glands, which is connected to the stomach, which is connected to the spleen, which is, how do all those systems work together to make sure our digestive system is working. But at the same time, our faculty is made up of medical doctors and PhDs. And the medical doctors and PhDs who teach you also have life experience. Therefore, you're not just learning theory. There are things that are more tangible that you need to hear from a medical doctor who has practiced, and you have an opportunity to be them. So the way your classes are is you do lectures in bigger groups, and then you break into groups of 7 who are assigned one faculty. So our ratio of faculty to students is 1 faculty for 7 students, which is very good. And it means you have an opportunity to interact. So I'll move on to the next slide. When I talked about clinical rotations, it is important to note that we have affiliate teaching hospitals. So most of them are actually in New York and Florida. And the reason is we have followed up and gotten accredited to those two states. But there are other states where you can go. We do have agreements with hospitals, and those states do not require us to have accreditation, but they give you opportunities to go there. So the way it works with clinical rotations is, I'll take an example, Jackson Park Hospital in Chicago would have spaces for students to do clinical rotations. Now, some of those spaces would be assigned to our students, and therefore you will be given an opportunity to choose 3, and then the hospitals then choose you to come for clinical rotations, depending on how you perform. So you do have an opportunity to select where you can go among all these hospitals. Many people ending up in St. Sinai. I know I have many in St. Luke's Hospital, and this is St. Luke's in Kansas City. So these are all places you want to end up. However, like I said, we take care of you and give you career guidance. If we know that you are interested in becoming a psychiatrist, and there's a program that is really good in psychiatry, let's say in Good Samaritan Hospital in Baltimore, we would then encourage you to apply into that clinical rotation, because it will be an easier transition for you to join their residency program. So all these things we take into consideration when we're doing affiliate teaching hospital agreements, and we make sure that we have few students so that you all have a chance to go into the spaces that are available. So this is our strength, and we make sure that we keep adding hospitals to the list. Now, important things for you to note, and I've been mentioning them. USMLE pass rates are very important for you to understand, and that is why I spent some time on that. Residency opportunities, clinical rotations, where you can go, what you can do, we've covered that. Cost is always important, and it's one of the driving forces of where you choose to study. Class size should be important to you, location and safety, and quality of education. All these areas are really important for you when you choose a medical school. Remember, medicine is not easy. So you do want to study in an environment that allows you to thrive. And it's a space that you will be in for a long period of time. And any steps that you take during your study time affect how you get your residency position. So all these things are really important for you. So we have a collaborative learning environment in all 3 universities, and we have maintained that. And the reason we maintain that, we noted that it's actually really good for students who are studying medicine to be in a space where they can interact. They can interact among themselves, and that's why we have a tight-knit community of students and faculty and interactive faculty. Remember, you're on an island. It's a small school. We only accept about 100 to 250 students into our med school. So the community itself is very tight. Study groups are important for anyone studying medicine, so we encourage that, and we create spaces for you to do that. Then we have a close student-teacher interaction, which is driven by the fact that we have 7:1 ratio of faculty to student to faculty. So we try as much as possible to create spaces and environments that is effective for your learning. Now, when it comes to the tuition fees, Seba's tuition fees is about $249,250. Then these amounts are in dollars, and they cover the 4 years of studying medicine, MD4. That is a 4-year program. So if you have that figure, you can divide it by 4. Then Medical University of Americas, it's about $225,000, and St. Matthew's is about $224,805,000. Now, that makes it about $50,000 a year, and Saba would be about $60,000 a year, and that's the estimate. Now, they are top medical schools in the Caribbean. There are 5 of them. We have Saba, MU, and St. Matthews, which we own, SGU and Ross, which are also big medical schools in the Caribbean, and their fee is about $100,000 more. So you would then be looking for what you can afford or what is more cost effective, because medical school is expensive, but at the same time, because we have smaller schools, and our smaller schools means we have lower running costs, we are able to make the fees affordable, not cheap, but affordable to medical students who want to end up in the US practicing as doctors. Now, one thing that I always like to share, and I think it's important for you to know, is that if you practice as a doctor in the US, your income is actually this amount within a year. So if you end up specializing, let's say you become a surgeon or maxillofacial surgeon, somebody who fixes like jaws and facial bones, that particular surgeon would earn $500,000 in a year. So it is an investment that returns pretty fast once you specialize. And then remember, you are doing this for 4 years, and then you get into a residency program where you will be paid and you get some money back. So this is a good pathway, huge investment at the beginning, but it's a really good pathway for anyone who is looking to invest in future, either in the US or to invest back home. So we've seen people do any of those things, either stay in the US or invest back home, because the returns are high. Now, we do offer scholarships, and scholarships are need-based. That means we have a discussion, we would talk to Global. Global will have had interactions with your parents or your guardians or whoever is paying for you, and they will be understanding your situation. So our scholarships can be anything from $5,000 to $20,000. And if we are to look at your income, what you're declaring as income, what you're declaring as you can afford, and then we look at what it is we can help you with, and then we also look at the grades. Grades are really important. If you're an A student, it's actually easier to get 20,000 as compared to a C student. And then at the same time, we then look at the situation in your country, and then we make a decision. But remember, like I said, it's partial, can be anything between 5,000 to 20,000. Now, like I mentioned, estimated intake for September semester, we had about 75 at SMU, 100 at Saba, and 100 at MUA. And that means for you, you understand that the fees does not go higher than that because we maintain small classes. But the other reason we maintain small numbers is because we've come to understand that studying medicine does not require large numbers. It is actually better for the students in small numbers. And therefore, having the 3 universities, we are able to spread out the number of students. On average, a US med school has 153 students, but we do have some that have 80 students, that have 60 students. So on average, it's 153. And we have maintained that model because we've seen it working. Other schools that are in the Caribbean might have bigger numbers. We have 900 plus students going to SGU. We have Ross, which has about 450 plus students, and AUA that has 400 plus students. Again, this means that it translates into more fees for you to maintain these bigger universities. So all these things are important for you to note. Now, like I said, we have full-time MD experienced teachers. All faculty hold an MD or PhD in the field they teach. And all faculty are full-time, hired with prior teaching experience. So we don't have part-time faculty. We do have visiting faculty, but all our faculty are full-time. Now, this table just makes it easier for you to look across the 3 universities and what fits you better. So like I mentioned with the accreditation, Saba has the Netherlands accreditation, MUA has ACCM accreditation, and SMU, St. Matthews, has ACCM. Now, Saba, if you look onto the line where it's talking about the pre-med program, now our pass rates or the students we accept into Saba are usually A, minimum B students, and they would have an equivalent of 3.25 out of 4 GPA if you're looking at the US GPA system. So you must be like over 80% performer, like all your grades are higher than 80%. And for that reason, you find that getting into Saba is a little more difficult if your grades are not good. But we do not say do not come, because we do have an opportunity for you to join Medical Universities of Americas or SMU. SMU, we even have further discussions and look at where your weak points, can we help you? And SMU is equipped to support students who have not got the A's or the B's. If you have a few B's and C's, we can have that discussion. So there is opportunity across the 3 universities for you to get in and study medicine. Of course, if you have D's, that's a little harder for us to place you. If you have lower than 2.8 GPA, it's going to be very difficult for you to finish med school. So we will not encourage you to join, but we can assess you and make a decision together with you as we look at which university can work for you. I'll go back to the USMLE pass rates. Now, remember, we've had this discussion where I'm saying Saba has greater than 99% pass rate for first-time takers of USMLE Step 1. This is the highest of all US med school, meaning the ones on mainland and the ones on the island. So this is the top school. And like I mentioned, we do take top grades into the top school. Now, MUA, remember we talked about the GPA being 3.0. It doesn't mean MUA performs less. It just means we give you more support for you to perform well. And that's why we maintain a 98% pass rate at USMLE. Again, you note SMU has a 97% rate, percent pass rate of USMLE, meaning we give even more support to the students who come to SMU because we understand they need more support in order to pass the med school. And this is based on their grades and what they come in with. So all these systems have been set up in such a way that the student gets a chance to, or an opportunity to become the doctor they want to become. Now, admissions is holistic, and we do acknowledge academics are good and important, but across the board, we do have an interview, and the interview does look at how you present yourself. Why do you want to be a doctor? It looks at critical thinking. We look at your a bit into how you deal with challenges and things like that. So our interviews are conversation, and these are the reason why we then can make a decision with your academics and decide where you go. Now, Seba is 29 years old, MUA is 23 years old, and SMU is 24 years old. So in those years, we have graduated doctors who have worked in the US and Canada. Now, consistency drives success. And this is something that is important for anyone who is studying medicine. So consistently, since 2015, we have maintained these pass rates. So for the last 5 years, so that we give you a snapshot, again, Saba has continued to be very high, MUA 97, 98, and SMU 97. So we've done well. If you look at the US medical schools, these are the ones represented. On average, they are a bit lower than us or comparative closer to SMU. And then international MD programs, these are other medical schools. They have maintained much lower pass rates. So for example, if a student decided to study medicine in South Africa and then take the USMLE exam, they would probably perform not as well as the student who has come to us or a student who is in the US studying medicine. So this is all important for you to understand on why you want to choose a school that has, or a university that has a consistent pass rate. Now, I talked about residency placements. So I will go a little bit further into what residency placements are. Now, after you graduate from our universities, you then get into this pool of medical doctors who are looking at residency positions. The more your university prepares you before you graduate, the better your chances of getting into a specialization that you want. Now, let's say you get in and you get 240 out of 300 points in your USMLE step 2. That's after your clinical rotations. 240 would qualify you to do family medicine or internal medicine. And majority of the students from any medical university in the US will end up doing family medicine or internal medicine. Family medicine specialization, which is about 3 years, is what gets you to become a general practitioner. Internal medicine will get you to become a general practitioner, but you would be in the hospitals. So this is primary healthcare in a way, a little, it is the beginning of, this is where anyone who is sick will first come before they're sent to the specialist. So it's very important to note that primary healthcare in the US currently has a shortage of about 33,000 doctors, meaning there's an opportunity for you to become a family medicine specialist and actually get a job and do things in the US. Now, let's say you do internal medicine or family medicine and you really wanted to be a pediatrician. Then what happens is you finish your residency in internal medicine or family medicine, and then you decide, I want to become a pediatrician. You then get into what is called a fellowship program. Or you do internal medicine and get into a cardiology fellowship program. This is a pathway you can take. However, let's say you scored 290 points out of 300 in your USMLE step 2, you can directly get into a cardiology program. So whatever your dream is in terms of specializing, there is a pathway for you to get there. It just depends on how you perform at every stage you get into. So med school has stages, and at each stage, you can decide where your path will take you. A lot of it is your hard work. A lot of it, as you get into clinical rotations, is how you interact with colleagues, and also how you interact with the research programs or activities that are happening around the hospital. So all these things count into your journey. Now, we've had students get into Johns Hopkins, Mayo Clinic. All these are top spaces you want to get into. Of course, it doesn't mean that you don't get into others, but these are actually top centers. They're among the top 20 hospitals of the US. And we do have University of Toronto Medical Faculty of Medicine, where some of our students end up doing their residency. So you can decide if there's space, you can decide to go to Canada instead of staying in the US. However, there's a difference. A Canadian doctor does not earn as much as a US doctor. The reason being, the Canadian system is, it's more like a national health program. So you kind of are limited in terms of your earning capacity as compared to the US, where you can branch off and specialize and then earn what your specialization can get you. So these are some of the reasons you would choose. But however, some people do prefer the Canadian health system for other reasons. So you can decide to do that as well. I talked about the scholarships. So this is Seba Island. This is a photo of the school is in there. Seba Island is tiny, it's small. And it is, like I said, a territory of the Netherlands. It's actually our Netherlands. It's like having a different district that's in a different location. It's in the Caribbean. It is tiny. And the best thing about the island is when you're studying there, you're there to study. And there are people living there. It's not a big community. It's extremely safe, nothing to speak of in terms of crime. But like I said, you have to be a top student to get in there. Now, Nevis Island, next to St. Kitts, actually most people call it Nevis and St. Kitts because the islands are actually together. Now, this is more active. It's a more active island, and it has some of the most romantic places to be. So if you decide you're getting married, that's one place you want to go. But they're also very exclusive areas of visiting. So you just don't get all travelers. Like not everyone can afford to go there. But the school is small. What we've done is made sure that we have created an environment where, yes, it's beautiful and all, but you are studying medicine. You need that space. And we've created a space for you to study. I studied in the Caribbean, and I must say, my first week, I was fascinated by the water and everything, and going to the beach and hiking, and I did that. But after that, when you get down to the books and you're studying with other people who are studying what you're studying, you actually concentrate, you settle down. And during your breaks, you will take a break and go for a swim or go snorkeling or diving, but your main focus remains studying medicine and passing your exams so that you can get to your dreams. Now, this is St. Matthews. St. Matthews is on Grand Cayman Islands. Cayman Islands are actually used to be a territory of the UK. So they are under the Commonwealth. And these islands are many. So there are many Cayman Islands. So this one is particular one is called the Grand Cayman Island. And the beauty of it is it's more modern than the others, and it has highly developed infrastructure. There are actually hospitals there that are really good, and some people do opt to do their clinical rotations in those hospitals. So it is up to you as you go there and you learn how it is. You can decide if that's a pathway you want to take. And then it's easily accessible from the US and Canadian cities, so it's easy for you to travel. And it's familiar because it's not like Saba, which is more like a very different environment from where you live. This one is a little more, it does look like South Africa in a way in some parts. So it makes it easier for students to settle in. But we have, like I said, we've maintained the small schools. So we keep maintaining that for the same reason of just making sure you're in a space that you are studying well and you have the environment that allows you to study well. Now, for all three islands, then Saba, you will require a Netherlands student visa. So you will apply for a Netherlands student visa, which is not as difficult as the UK student visa, but you will apply for that. Then for Cayman Islands and for Grand Cayman and for Nevis, you are required to put in your paperwork so that you can collect your visa on arrival. So your biggest challenge with those ones is to put in your paperwork in time so that by the time you're traveling, you have your visa on arrival. And then for transits, that would be your other challenge. So you can either travel to the UK to Antigua to your island. Or you can travel to New York, or you can travel to Miami. All those are points where you can go to as transit. Now, the visas you require when you're doing your clinical rotations, we sponsor them. You get the hospital, which gives you a letter, and then you apply for the visa and you get it because you are our student and you are going to do your clinical rotations. But the most important thing is to note that you are going to be required to get that visa. And we do provide you with all the support to get it settled, and that's not a problem. We haven't had a situation where a student hasn't gotten it for any reason. So if it does happen, it's because there's another challenge beyond what we have. Now, when you're doing your residencies, you're supposed to get a HB1 visa. Now, that particular visa is sponsored by the hospital that takes you for the residency position, because you are employed by them. And not all hospitals in the US are willing to do that. So what we have done is make sure that in your clinical rotation hospitals, that they are hospitals that are going to do your visa. So this is something that we have done strategically to ensure by the time you're doing your residency, you're in a space where you can get the correct paperwork that you require to do your residency. To do an application is actually pretty simple. You can finish this call and send a Global Education your transcript and tell them to get it assessed. By assessment, I mean, they'll send it to us and we will look at it and recommend which university you should apply to. Now, once we get your transcripts, for the first, I think for the first 10 students, we are going to do your equivalency evaluation for GPA rating. It is an equivalency evaluation that's done, it costs about $300, and we do it for you because you're the starting students. And then in future, of course, this can change and we would definitely let you know. But remember, we need you to have good grades for you to do that. Now, work experience would be great if you had it, but if you don't have it yet, because we remember COVID time, you couldn't go to a hospital to volunteer, you couldn't shadow doctors. But if you have any of that, it's actually good for you when you're doing the interviews. We used to require that you have 50 hours, but it is not a requirement at this point in time. But we will encourage you to volunteer in a hospital before you start your classes. Once we've accepted you, it is nice if you get a chance to volunteer, just to know what kind of environment you'll end up in. 2 letters of recommendation are required from your lecturers. So since you're coming from a university, that's the only students we take. They need to get 2 letters of recommendation that are on the institution's letterhead and signed. And a personal statement of about 500 words. And Global Education can help you understand what that should look like. And that's really important because this personal statement is what makes us look at you further and want to know you more. Now, the financial statement is not your bank statements. It's a discussion. We look at your finances and how they work. And remember when I was talking about your scholarship, these are some of the discussions. But what's important is you will be interviewed. So once you submit your application with your transcripts, official transcripts, those are good, but in future, we will require your university to send the transcript directly to our university. But you can use the one you have to do your application, finish that, we get you your interview, you get your acceptance, and life continues. So after you get your acceptance, we support you through the process of onboarding. And onboarding is actually pretty direct, and we work with you through the steps. So this is a diagram just showing when you do deposits and all that. So the committee of admission makes a decision. We can get you an decision maybe in 3 weeks if you have everything you need and you can know whether you accept it or not. And then you are required to submit a deposit within 3 weeks of acceptance. If you do it within 3 days, you actually get a guaranteed $5,000 scholarship. So that is also something else to look at. And then we can look at further scholarships if you require. And then you matriculate, we take care of your, or we support you to do your immigration and all that. And then you travel to Nevis, Saba, or Grand Cayman Island, and you start your MD program. I'd like to play a video. I'm hoping this will go.
Because I always expected from grade school that I would go, finish high school, finish 4 years of university, 4 years of medical school. I always thought that that would be how it goes. And when I finished my undergraduate and I wasn't in that place, I had to take a little bit of a detour. I know there's quite a few medical schools in the Caribbean, and there's a couple of them that are actually known to be really good ones. And Saba was in the top 3 of those schools. I didn't expect to love the island as much as I actually ended up. I met a lot of really nice local people who live there. I met really good friends. They always say that the Saba students work the hardest and we were ready to go compared to some of the other students from maybe other schools or maybe other American schools, because everything isn't just handed to you. I decided I wanted to do a specialty, and that was what my heart was set on. So I knew whether or not I go back home to Canada or go to the States, it was going to be obstetrics for me. It's competitive. So, you know, while my classmates are getting 3, 4, 5 interviews at one time, I'm only getting one. I have fewer interviews, but I told myself, you know, you went through all of this, you need to do a specialty that makes you happy. Even if you have to do another year of something else and then get in, at least your goal at the end, you're going to be practicing what you love to practice. So right now I start my residency in July. I'm going to the University of Toronto for obstetrics and gynecology. If I could say what Seba has given me, I would say Seba gave me the tools I needed to succeed.
Okay, so I'll not play all the other videos because you can find them online. So these are our contacts. You can always reach out. We work in partnership with Global Education, so don't feel shy to reach out to us. And then we can get back with Global and see how we can support you. And there's my phone number, which is actually a WhatsApp number as well, and my email. So thank you very much. I'm open to questions.
Hi, Vicky. Wow. I want to become a doctor now. So that was awesome.
You're very welcome.
Absolutely fascinating. I think I speak on behalf of everybody that's here tonight that was absolutely fascinating. I definitely picked out an island for myself. Vicky, we have a question here from Anonymous that I just want to see if you know, if you have any insight on. When you said in your slideshow that the universities are looking for an holistic application, are they looking at things like community service? Are they looking for active, you know, service members in the community? What can you elaborate a little bit about what they define as holistic?
Okay, so holistic for us is beyond academics. Have you had any interaction with a hospital or with doctors? But we do acknowledge one of the things that's really important is the fact that we are in Africa and we do get to do community service. And some of the things that I have learned, like I learned about, let's say, TB programs, I have learned when I'm doing community service. So we do look at community service as part of the work experience. So yes, please feel free to share any community service you have done, any community engagement you have done, because all this brings out beyond just your medical side, it also brings out your humanity. Like, how do you view the world? What is your worldview? It also explains why you think you can become a good doctor, because you've seen things, you've experienced things in your community, and you understand the community you live in, which is also a very good trait for anyone who wants to be a doctor. Because when you're a doctor, you don't work in an office with a desk and a computer. You are engaging with communities. You are going to be engaging with people. So it just strengthens your application if you have that. So feel free to share that. That's why we talk about holistic.
And that's the beauty of applying to your partners, is that it's not just academics.
Yeah.
It's you know, I had a question from Anonymous come in. Are there fully funded scholarships for financially unstable students?
Okay. So at this point in time, we do not have fully funded scholarships, and maybe in future it could come, but at this point in time, I can tell you right now, we do not have. We only have the partial scholarships, which can be between $5,000 to $20,000. So we do understand, like I live in Kenya, by the way, and I do understand the challenges of having the grades and you really want to study medicine, but you cannot afford to study abroad. So it does limit you and make you have to stay in country. And I usually say, if it does happen that you end up studying in country, what you can do in future is take the USMLE exams and try to move to the US to do your residency. Again, it will be financially challenging for you. And it does mean that you do start with a handicap when you're applying for residency positions. But if that's what your path has defined, that's what you do. But if you can afford it and you get into med schools, it means you'll do your clinical rotations in the US, meaning you are as competitive as any other med student who has graduated in the US when you're doing your residency applications. So it's something that it's difficult for us to say, no, we cannot give full scholarships, but this is the situation at this time.
Fantastic. I have another question from Anonymous here, and the question is, when should we look at applying?
Okay, so we have 3 entries. We have January, we have May, and we have an August entry. So our applications are opened throughout the year. So we don't say apply for Jan by this time, apply for May. We would prefer
it's rolling intakes.
Yes, rolling intakes, but no, actually rolling applications, but specific intakes.
Okay.
So we would prefer you finish your application 2 months before the start date. So if you're planning for January, we would prefer that you finish your applications by November. And the same thing for May and the same thing for August. But if you don't, like now we have classes starting in May, I have applications for students who are going to start in August. So they did not come early enough, or some of them have decided or opted for August. So if you apply 3 weeks to the start date, it might be hard for everything to be done, especially on your side, because you'll need to work on the visas. So the limitation will not be on our side. It will be for you to turn around the visa situation, and that can be hard.
Yeah, unfortunately, to our listeners and our students watching a little bit later, we do like to give our visas a minimum of a 4-week head start. Unfortunately, we never know exactly how long a visa is going to take. You know, your visa might take 4 weeks, but Victoria might only take a week and a half. So there's so much of the unknown. So we really do encourage our students to even come to us 5 months before you want to start, just so that we can get all of your information together, make sure all of your documents are right, all the T's are crossed and all the I's are dotted. I'm going to ask, there was a comment made by a student earlier, and she just said that she's from Zimbabwe and is studying her A-levels, but there was no question to the comment. I'm just going to allow the student a couple of seconds to type in her question, if that's okay with you.
Yeah. Meanwhile, as we're waiting, we do not take A-level students or IB diploma students at this time, but in future, if it does happen, Global will be available to let you know if there are opportunities for you to join us straight from A-levels or IB diploma. But at this time, we take students who have completed a Bachelor of Science. Now, for the ones doing a Bachelor of Science, if you have completed your 3rd year and you haven't gone for your honors, and we assess your equivalency and we see that you have more than 90 credits, we would definitely take you without the honors. So you don't have to do the honors if you have the number of credits that we require.
And that's incredibly helpful, because as you know, Victoria, in South Africa, your honors is something that you have to apply for independently. There are only a handful where your honors, where the honors year, the 4th year is included. So that's, you know, a couple of your business degrees, but predominantly your education and your engineering degrees.
Yeah.
From Global Education, we would like to thank you as a student for joining us this evening, and more importantly for my friend and my colleague Victoria for really spreading the knowledge tonight. I think Victoria, we will receive many inquiries after this. I know sometimes it can be a little bit of information overload with students sitting there with their notebook, trying to write everything down, and we do appreciate that. So I would like to encourage all students to take a photo of the screen right now to get in touch with us at Global Education. If you would like to speak to Victoria or another member of staff at the R3 group, we will facilitate that, not a problem. Victoria, thank you so much. I hope you have a lovely evening. And I will see you soon.
Yep. See you. Bye-bye.
Awesome. Bye.
Thank you.